of a temporization procedure that we can follow. As we can see that normally we get such kind of cases in which an RCT needs to be performed followed by a crown which has to be given in this tooth. So for this purpose, before starting with root canal procedure or with any kind of modification of the tooth, we make a putty index which we will be using for direct temporization inside the patient's mouth. So this is a condensation polyvinyl siloxane material, condensation silicone material, and we use this to make an index. As we can see that I am using nitrile gloves with this. Our silicone gloves that are provided prevents the setting of siloxane material, thus we use nitrile gloves for this procedure. So this is the putty consistency and the activator of our siloxane material. Before starting with any kind of modification to the tooth structure, we take a putty index which will help us in temporization of the tooth. So we manipulate this material till we get a uniform color, and after manipulation we adapt it over the tooth surface. While this putty index sets, and we can see that it has become hardened, and then we remove the putty index. Now this is what we have been able to achieve using the putty index. Make sure that when you are taking a putty index, the tooth that you need to temporize, at least one tooth adjacent on both the sides should be present on the index. This will help us in seating of the index. So we cut off the additional any extra part that was obtained in the index, because that we won't be needing. Use a scalpel to trim any excess from the index, and this is the tooth that needs to be prepared, and these are the adjacent teeth which will help as a vertical stop. Now for demonstration purpose, we have already achieved tooth preparation on this tooth that we had taken an index of. So we apply a small amount of separating medium, usually Vaseline, around this tooth and the adjacent teeth, so that our temporary material does not stick with the tooth. After that, we once again confirm that our putty index is seating over the tooth. So we once again check whether our putty index is seating on the tooth, and then we fill this tooth that we need to temporize using a bisacrylate material. This is a bisacrylate material which is supplied, and we use a special gun to inject this material in the area of our temporary tooth. We slightly overfill the material, and then we seat this index over our prepared tooth. After it starts setting, we remove any additional material that has flown below the index. And let the material set. After the initial set has happened, we remove the index, and this is the temporary tooth that is being formed. We remove this temporary tooth that has been made, and you can see that the shape of the tooth is according to our natural tooth that was obtained. This is the tooth that has been formed. We mark the margins using a pencil. We mark the margins using a pencil. And we'll shape this according to the margins, and then we'll seat it and check the seating. This is the final temporary ground that we are able to achieve after the finishing and polishing, and we seat it over our prep and check for marginal accuracy and the glue. So we have been able to achieve the same day temporization. This is a direct method of temporization inside the patient's mouth that we achieve using a putty index and this acrylate resin.